Welcome to Sam Houston State University College of Osteopathic Medicine's Preceptor Orientation. Thank you so much for being a preceptor and providing our student doctors the opportunity to learn, grow, and ultimately reach their goal of providing quality healthcare to medically underserved communities. This orientation will walk you through what is required of our students in their third-year clinical clerkship rotations, when their didactic sessions are, and the course directors in charge of the curriculum, the responsibilities of our students, the COM, the clinical sites, and you, the preceptor. At the end, we will provide the contact information for the clinical education team, so no matter where you are, you will know who to contact. During year 3, our student doctors are required to complete 9 core rotations. Each core rotation is 4 weeks long. They're required to complete at least 2 rotations in adult inpatient medicine and at least 1 rotation in emergency medicine, family medicine, general surgery, pediatrics, psychiatry, rural and underserved medicine, and women's health. The students will complete 3 elective rotations with the remaining time in their third year. They can use these blocks to complete additional rotations in the core specialties or any other specialty they have an interest in. Additionally, the students must complete training with a resident sometime during their third or fourth year. As a preceptor, you are not required to provide any formal academic instruction. Each core clerkship rotation has a course director responsible for providing our students the didactic portion of their clerkship training. The students have dedicated time built into their schedules each week to meet with their course director for lectures. That being said, we know many of you have a great deal of experience teaching and precepting medical students. So while it's not required, we welcome any suggestions or questions you may have about the content our students are learning. Students should be excused no later than 12 o'clock noon every Friday for synchronous instruction. The first 3 Friday afternoons are used for didactics, while the 4th and final Friday afternoon of every rotation is used to administer the appropriate shelf exam. Shelf exams are administered and proctored by a member of the clinical education team. The first rotation will begin on August 1st, after our students have completed a 1-month intensive preclinical placement course where they review and refresh the skills needed to be successful in the field. This ensures they are ready to hit the ground running from the moment they show up. Additionally, once every semester, SHSU-COM's OMM faculty will provide in-person OMT training for our students in each region. Our students and our clinical coordinators will communicate with you when those scheduled times are, and we ask that our student doctors be excused during those scheduled times so they may attend the trainings. As the supervising physician and preceptor, you get to determine each student doctor's normal work hours. These work hours must adhere and be consistent with current guidelines. SHSU-COM student doctor work hours must adhere to the following. Student doctors will not be permitted to work over 80 hours per 7-day week, averaged over a 2-week period. Clinical rotations that are scheduled as shift work, such as emergency medicine, will be limited to 12-hour shifts with a minimum of 10 hours between each shift. Student doctors are permitted to take call, night float, and to work weekends, but they must be permitted to have one continuous 24-hour period free from all educational and clinical activities in a 7-day period. Medical students cannot be scheduled for in-house call or night float more than every 4th night. Clinical coordinators, preceptors, the Director of Clinical Education, and the SHSU-COM Associate Dean for Clinical Affairs are permitted to institute more restrictive duty hour guidelines than listed above. However, Work hours may not exceed or violate the current residency duty hour guidelines. Now that we've established when student doctors will be with you, what can they do while they're there? Students can do research on difficult or interesting cases. With current technology, it's easy for students to help find current guidelines and relevant articles at the attending physician's request. This is a good learning opportunity for use of point-of-care tools to enhance evidence-based practice. Students can be given assignments and time to complete them based on what they see during patient care. Students can also review diagnostic tests and report abnormal findings to the attending physician. These tests can be for things they will see or simply interesting cases you'd like them to review. Medical students do not need constant attention. They are adult learners and should be encouraged to employ self and peer-to-peer learning. With permission, medical students can see patients that may take up an excess of your time. Patients who have long histories can be seen by students who can then provide the relevant details. During busy times, patients appreciate that the student can listen to their story and give them more time than the attending may be able to spare. This is also a good opportunity for students to learn how to ask the right questions, listen for the important information, and form a comprehensive report. Now let's take a look at the breakdown of responsibilities for the students, the College of Osteopathic Medicine, and you, the preceptor. While completing rotations, our student doctors are to work with SHSU-COM faculty and staff to ensure all rotation requirements are confirmed in a timely manner prior to the beginning of each rotation. They are to be compliant with all required immunizations and trainings, including BLS, ACLS, HIPAA, and bloodborne pathogens. These trainings are all provided by SHSU-COM. Students are to actively participate in every learning experience by being proactive, engaged, and enthusiastic in assigned patient care activities. They are to be familiar with each rotation syllabus and complete all learning objectives, participate in required OMM learning activities, and fulfill all required assessments, including discipline-specific COMAT and SHSU-COM generated examinations as they're assigned. Our students are to always demonstrate professionalism through appropriate behavior and attire. Students are responsible for providing appropriate feedback by completing evaluation forms provided by SHSU-COM at the end of each rotation. Their feedback will be used to augment learning opportunities for future students. Our student doctors are to ensure the required individual medical insurance coverage is current in the event of an acute illness or injury while completing clerkships. They will also obtain a National Practitioner Identification Number, or NPI. With prior approval from the site, their NPI allows them to document in your electronic medical record. When verified by the attending physician, student documentation can now be accepted without being redocumented. Students are also responsible for scheduling and passing COMLEX Level 2 CE and Level 2 PE if reinstated prior to graduation. SHSU-COM student doctors are and will continue to be held to the highest standard of professionalism. In addition to their other responsibilities, students are expected to demonstrate the following: respect, compassion, and a responsiveness to the needs of patients and society that supersedes self-interest, accountability to patients, the osteopathic profession, and a commitment to excellence and professional development. A positive attitude towards learning, which includes participation, enthusiasm, and providing meaningful feedback. Initiative and self-motivation by showing up prepared to learn and with a willingness to contribute to the learning of others. Reliability. They can be counted on to be punctual and to complete all assignments. Accountability and willingness to accept responsibility. They should know their limitations and have a willingness to seek help when appropriate. Communicate with peers and appropriate personnel in a timely fashion when issues arise that affect attendance. Sensitivity to the patient's culture, age, gender identity, and abilities. Compliance with all SHSU and clinical site policies. Ethical behaviors when interacting with patients and healthcare team members, and an awareness of and adherence to appropriate physician-patient boundaries. SHSU-COM is here to support our students, our preceptors, and the clinical sites in every way possible. Some of the College of Medicine's responsibilities during rotations are arranging and monitoring clinical clerkship education for students in cooperation with the clerkship clinical practice site, credentialing and re-credentialing preceptors, providing every preceptor information that includes student information and syllabi for the appropriate clerkship experience, providing malpractice coverage for students on rotations, providing online tools to supplement rotation experiences to ensure a standardized quality of education across all regions, providing continuing OMM training for all of our students, arranging the administration of and proctoring of COMAT or shelf exams, providing sites with required information like required immunizations, background checks, and drug screenings. To ensure that we're setting up our student doctors, preceptors, and the clinical site for success, we ask that the clinical placement sites provide students with orientation to the clinical facility to help them acclimate and understand the policies and procedures in place. Within a reasonable time request, we ask that clinical sites allow our accrediting body, COCA, permission to access and inspect the clinical practice site for visits pertaining to SHSU-COM accreditation. Lastly, we ask that all sites maintain the confidentiality of student performance in compliance with FERPA. As an SHSU-COM preceptor, your responsibilities are simple yet crucial. We ask that you provide a professional, constructive, and educational environment. Our goal is for our students' presence to enhance the quality of care provided to your patients, while our students have the chance to grow and develop as young physicians. We ask that you maintain the confidentiality of student performance in compliance with FERPA. This does not, however, restrict you from communicating any concerns with the SHSU-COM clinical coordinator in your region pertaining to things like professionalism, attendance, mental health, academics, and so on. Please provide the students feedback on learning and patient care expectations throughout the clinical rotation to enhance the student experience and assist the student in achieving successful completion of the rotation. Lastly, it is vital that you complete and submit the midterm and final evaluations for the students that you teach. Next, let's go over evaluations, where you can find them, what they look like and how to fill them out, and why they're so important for you to complete. Both the preceptor and the student doctor are responsible for completing and submitting 2 evaluations through each clinical rotation. The preceptor will be given a midterm evaluation and final evaluation to complete for the student. Links to these evaluations will be sent out during the week that they are due. They'll be emailed to you, and the link will take you directly to the portal where you can fill out and submit this evaluation. Students will complete evaluations at the end of the rotation, evaluating you as the preceptor and the site that they completed their rotation in. If you are interested in receiving any of this feedback that is submitted, you are more than welcome to request it from the clinical education team. Both the preceptor and the student doctor are responsible for completing and submitting 2 evaluations each during the clinical rotation. The preceptor will fill out a midterm evaluation and a final evaluation of the student's performance. A direct link to the appropriate evaluation will be emailed to you a few days before it is due, allowing enough time to meet with the student to review the comments before submitting the evaluation. The student doctors are responsible for setting up a quick meeting with you to review their performance. An evaluation of the student's clinical performance is required for the student to receive credit for that rotation. At the end of each rotation, students are tasked with evaluating their preceptor and the site they are completing their clinical rotation at. The midterm evaluation is a total of 4 questions plus an acknowledgement. Question 1 is about any areas of concern, whether it's attendance, professionalism, clinical knowledge, or you have the opportunity to indicate that you have no concerns at this time. Question 2 provides an open-ended opportunity to elaborate on if you have any concerns about the student. Question 3 asks you to indicate the level of performance of the student doctor as of the date of this evaluation. Question 4 is an opportunity to provide comments regarding the student doctor's performance. We encourage you to provide specific examples to supplement your ranking in question 3. Your feedback is valuable in multiple ways to the student doctor's journey. Objective and constructive feedback will help the student be aware of what they are doing well and what they can improve upon. Also, the comments provided may be quoted verbatim in the student's dean letter. It is crucial that you provide true and honest feedback about the student's performance in this section. If you have any questions or concerns about leaving comments, please feel free to reach out to your SHSU-COM clinical coordinator. Question 5 is an acknowledgement of all previously stated information and acts as a digital signature. While the midterm evaluation was a more general analysis of the student's performance only 2 weeks into the rotation, the final evaluation is a more granular analysis of the student's competency level. There are 7 categories that we would like you to analyze the student's competency in, a section to leave comments, as well as an acknowledgement that acts as your digital signature. The first category we would like you to evaluate the student in is patient care. Does the student provide care that is effective with regard for health promotion, wellness, treatment of illness, and end-of-life care? Do they demonstrate good judgment, perform an adequate history and physical appropriate to the specialty, and are they respectful of the patient? The second category is medical knowledge. Does the student demonstrate a knowledge base consistent with the student's level of training? And do they apply this knowledge effectively in the patient care setting? Do the students exhibit a commitment to continuous learning? And do they apply clinical reasoning skills? The third category is practice-based learning and improvement. Does the student doctor understand evidence-based concepts, and do they apply sound principles of practice within the scope of patient care? The fourth is interpersonal and communication skills. Was the student doctor able to establish rapport and solicit information, Could they maintain detailed, legible, and timely medical records and communicate with the preceptor and other members of the team? Number 5 is professionalism and ethics. Did the student behave in a professional and ethical manner at all times, including in his or her personal behavior, interactions with patients and peers? Were they able to maintain boundaries in professional relationships and relationships with patients? Number 6, systems-based practice. Did the student doctor demonstrate awareness and responsiveness of the overall healthcare system, and did they demonstrate knowledge of cost-effective care? The 7th and final category is osteopathic principles and practice. Was the student doctor able to incorporate osteopathic philosophy into the evaluation of patients and use osteopathic techniques when appropriate? The 4 key osteopathic principles are: the body is a unit. The person is a unit of body, mind, and spirit. The body is capable of self-regulation, self-healing, and health maintenance. Structure and function are reciprocally interrelated. Rational treatment is based on an understanding of the basic principles of body unity, self-regulation, and the interrelationship of structure and function. After evaluating these 7 categories, Question 8 gives you an opportunity to provide comments regarding the student doctor's performance during this rotation. We encourage you to include specific examples as, like the midterm evaluation, your feedback is valuable and could be incorporated into the student's dean's letter. After you provide your comments, your acknowledgement of the evaluation acts as a digital signature, and you're ready to submit. SHSU-COM's clinical education team is here to provide you and our student doctors any resources needed for success. Sam Houston State University's College of Osteopathic Medicine, as you know, is based in Conroe, Texas, but our students will be completing their clinical rotations all throughout East Texas and beyond. Because we are dedicated to creating a seamless connection between our campus, our clinical sites and preceptors, and our students, we have regional clinical coordinators in each territory that our students will be completing their rotations in. Our clinical coordinators live in the areas they serve. I encourage you to reach out to them as their first point of contact if you have any questions or concerns. Go ahead and save their email, their work cell phone number, and their names so that anytime that you need them, you have their information readily available. You can call, text, email, FaceTime, Zoom, whatever option works best for you. Our regional coordinators are ready to help. In addition to and in support of the clinical coordinators in your region, the clinical education leadership team is always here to answer any questions you may have or provide any resources that may be helpful in supporting yours and our student doctor's success. Please feel free to reach out to our lead clinical coordinator, our director of clinical education, or our credentialing specialist at any time. On behalf of everyone here at Sam Houston State University's College of Osteopathic Medicine, thank you for your time and your commitment to being an SHSU-COM preceptor.